The most common piece of advice given for poor leg circulation after 60 might be the exact thing keeping you stuck. Get up and move. That's what people hear on repeat, and moving is genuinely worthwhile, so let's be honest about that up front. Keep doing it. But there's one very particular action that physically drains blood out of your lower legs and sends it climbing back toward your heart, and casual walking barely touches it. I'm Dr. James Myers. Across the years, I've sat with patient after patient who followed every rule in the book. Daily walks without fail, legs propped on a cushion each evening. The compression stockings their doctor prescribed, faithfully worn, and still they'd land in my office with icy feet, ankles puffed up by supper time, calves aching with a dull burn, and that wobbly, lightheaded feeling the second they stood too quickly. They were putting in real effort. Nothing was shifting, and they couldn't figure out why. Here's what nobody had ever taken the time to lay out for them. Sluggish circulation past 60 isn't some minor inconvenience you learn to tolerate. Once blood flow through the legs slows down, minor scrapes and sores stop healing properly, infection can set in, and in serious cases, people lose a toe or even a foot. It's also frequently among the first red flags that your heart and arteries are already under pressure. Roughly 1 out of every 5 people aged 70 and up is living with what's medically termed peripheral artery disease, a narrowing of the leg's arteries, and the majority of them don't even know it's happening inside them. So it deserves a real explanation. And if you're tempted to scroll past because you figure you've heard it all, walk more, elevate your feet, stay hydrated, stick with me 2 minutes, because those cold feet at bedtime have almost nothing to do with your daily step total. It traces back to one single muscle that barely crosses most people's minds. And the moment you learn how to activate it properly, the solution turns out to be far easier than you'd expect. Let me introduce you to that muscle. It's your calf. Medically, it's called the calf muscle pump, though plenty of people simply call it your second heart. And that's not just a nice turn of phrase. Each time your calf tightens, it clamps down on the deep veins running through your lower leg and physically forces blood upward, fighting gravity, back toward your chest. Microscopic one-way valves inside those veins click shut right behind each surge so nothing slides back down. That's the whole mechanism. That's your second heart clocking in with every single step. The issue is what happens to that mechanism once you pass 60. Vein walls lose their firmness and start to sag. Those tiny valves begin leaking, and the calf muscle itself shrinks and weakens, particularly if a large chunk of your day is spent seated, which describes most of us. So the pump loses momentum, and as it slows, blood collects at your ankles instead of rising. Swelling worsens, feet grow colder, the skin down there starts falling short on oxygen, and the less you're up and moving, the feebler the pump becomes, which in turn keeps you moving even less. It turns into a gradual downward spiral, and plenty of people are already somewhere along that path without realizing it. Now, here's the encouraging part, and it truly is encouraging. Turning this around has nothing to do with your daily mileage. It comes down to a small set of precise movements engineered to physically shove blood back up where it's supposed to be. I'll walk you through 5, one at a time, counting down from 5 to 1. Each brings something to the table that the last one couldn't. And I'm holding back the single most effective movement for the finale. The one exercise vascular rehabilitation clinics across the globe rely on more than any other to restore blood flow after 60. If there's only one takeaway from this entire video, it's going to be movement number 1, but it will land far better once we've worked our way up to it together. One quick note before we dive in, because it matters to me that you hear this. Everything I'm about to walk you through is a single piece of a much larger puzzle. The quiet daily choices that ultimately decide whether you're still moving with confidence at 80 or leaning on a cane at 70. So I gathered everything I share with my own patients about staying independent and mobile through these years and built it into one straightforward plan. It's already supported thousands of people in living fully after 60. If you'd like it, the link is sitting right on your screen. No need to jot anything down, and you'll never catch me reading a web address out loud to you. Before we get into the movements, let me introduce you to someone. I'll call him Robert Hansen, and he represents a composite of numerous patients I've treated over the years, so nobody's privacy is exposed here. Robert was 71, quick-witted, still behind the wheel, still hosting his grandkids every Sunday. But his feet turned cold every night, even at the height of summer, and his ankles swelled up like risen dough by dinner time. He'd been walking a mile daily for years without fail, and quietly, it frustrated him that it wasn't making a dent. Hold on to Robert's story, because what eventually turned things around for him is exactly what this video is building toward. Let's kick off the countdown at number 5, ankle pumps. This one seems almost too basic to bother with, and that's precisely why so many people dismiss it and move on. It's frequently the very first movement given to patients right after leg surgery, before they're even cleared to stand, specifically because it prevents blood from pooling during recovery. The mechanism behind it is simple. Flexing your foot upward and then pointing it downward makes your calf contract and release, and that motion squeezes the veins, pushing along blood that had been sitting stagnant near your ankles. A 2025 review published in the Journal of Orthopedic Surgery and Research pulled together 16 separate randomized trials and discovered that basic ankle pumping enhanced upward blood flow in the leg and reduced lower leg swelling among older adults, with 0 standing and 0 walking required. The real trick is doing it slowly, with intention, and doing it consistently. Here's the proper form. Sit in a chair with both feet flat against the floor. Draw your toes upward toward your shins while your heels stay planted. Then flip it. Push your toes into the floor and raise your heels the way you gently ease down on a gas pedal. Slow and controlled. That counts as 1 rep. Aim for 20 to 30 reps 2 or 3 times daily. You can knock these out while watching TV, reading a book, or waiting at the kitchen table for the kettle to whistle. It costs you nothing but a handful of minutes. Consider how much of your day is spent sitting, in the car, during meals, in your armchair come evening. During every bit of that time, your pump sits idle and blood settles in your feet. Ankle pumps flip it back on without requiring you to even stand up. Walking runs on forward momentum. You lean forward and catch yourself, over and over. Your calves barely get a complete squeeze out of the deal. Ankle pumps force the muscle to genuinely contract and drive blood forward. That translates into warmer feet, reduced swelling, and less strain on those delicate veins. It's also among the safest starting points if pain, shaky balance, or plain exhaustion keeps you off your feet for long stretches. But ankle pumps only stir the system awake. The next movement targets the larger muscles further up your leg. Number 4, the seated leg lift. If you assume sitting down makes this the easy option, your legs will tell you a completely different story about 10 seconds in. Extending your leg straight out in front of you and holding it there activates the major muscles across your thigh and the front of your hip. Those are precisely the muscles you depend on to rise out of a chair, climb a staircase, or catch yourself before a stumble turns into a fall. As they contract, they press against the large veins traveling up through your thigh and help push blood out of the leg. Ordinary walking barely taxes those muscles enough to slow the decline that comes with aging. This matters more than most people grasp. And here's the detail that ties it all together. Geriatric specialists monitor something called gait speed, essentially how quickly you walk. It's referred to as the 6th vital sign, right alongside your pulse and blood pressure, because your walking pace has been shown to forecast fall risk, independence, and even life expectancy. When walking slows down, it's often one of the earliest signals that the body is quietly losing ground. Building strength in the muscles that carry you is exactly how you hold that ground. So here's the technique. Sit tall in a sturdy chair, back pressed firmly against the seat, both feet flat on the floor. Slowly extend one leg straight out ahead of you, keeping the knee as straight as feels comfortable. Hold for 2 seconds, then lower it back down gradually without letting the foot just drop. That's 1 rep. Complete 10 to 15 reps on one leg, then switch sides. The detail almost everyone overlooks is the back. Keep it firmly against the chair so you can't cheat by rocking and borrowing momentum. That's what forces the correct muscles to actually engage. And that's where the circulation payoff comes from. Once this starts feeling manageable, layer in some resistance. A light ankle weight or a resistance band wrapped around your foot. Even a pound or 2 makes a genuine difference. Muscle responds to gradual, steady loading at any age, and older adults frequently progress faster than anticipated, simply because they're starting from a lower baseline. This movement builds the strength that keeps you walking, and it drives blood through the upper leg in a way ankle pumps alone can't reach. But even powerful thighs won't protect you if your balance system isn't firing correctly, and that's exactly where we head next. Number 3, the supported calf raise. This movement trains your circulation and your balance simultaneously. And balance is the deciding factor in whether a person retains their independence or gradually loses it. The National Institute on Aging states this plainly. Maintaining strong lower body muscles ranks among the best things you can do to preserve mobility as you age, to keep getting up from chairs, off the couch, and up the stairs without needing assistance. And your calves sit at the very center of that equation. Every contraction squeezes those deep veins and forces blood upward against gravity. Weak calves mean pooling blood, rising swelling, and slower balance reactions. So an ordinary stumble becomes far more likely to turn into an actual fall. Let me pause for just a second here, because I've got a small favor to ask, and this is a natural moment for it. If any of this has been useful so far, go ahead and subscribe, tap that like button, and drop a comment telling me which of these 5 movements you're planning to start with today. I read every single comment that comes through, and it genuinely shapes what I create next for you. That's it. Now back to your calves. To perform a supported calf raise, stand behind a sturdy chair or at a kitchen counter, resting your hands lightly on it for balance. Feet roughly hip-width apart. Rise slowly onto the balls of your feet, lifting your heels as high as feels comfortable. At the peak, pause for 2 or 3 seconds, keeping your eyes forward rather than glancing down at your feet. Then lower yourself slowly, taking a full 3 seconds to descend. That unhurried pace and that brief pause at the top are where the real benefit happens. It makes your calf muscles and balance system fire in tandem, exactly what your body needs to do when catching itself mid-stumble. Start with 10 reps. Build toward 20 or 25 as strength improves. Within just a few weeks, this single movement enhances your ankle stability, your circulation, and your reaction speed all at once. And it accomplishes all of that without pounding on your knees or hips. For many patients I've treated, this is the movement that first made them feel genuinely stable on their feet again. But standing on 2 feet is the gentle version. The next movement removes one of them. Number 2, the single leg stance hold. Before you dismiss this as pure balance work with nothing to do with your blood, let me share the number that made me take it dead seriously. Back in 2022, researchers writing in the British Journal of Sports Medicine tracked more than 1,700 adults over several years. They discovered that people unable to balance on one leg for just 10 seconds carried an 84% higher risk of dying during the following years compared to those who could hold it. 84%. And here's the part that stops me every time. Among adults in their early 70s, fewer than half could even pass that basic test. A 10-second balance check revealed more to those researchers about someone's future than almost anything else they measured. You can actually attempt this right now, carefully, with a counter or sturdy chair nearby.
Stand tall. Position one hand near something to grab if needed. Lift 1 foot an inch or 2 off the floor and see whether you can hold steady for 10 seconds without grabbing on. That's the test. And it also happens to be the exercise itself. The reason it does so much for your blood flow comes down to duration. The moment you stand on one leg, your calf, ankle, hip, and core all have to contract and stay contracted to keep you upright. That sustained squeeze keeps the pump active the entire time, driving blood upward instead of letting it settle back into your foot. Ordinary walking never demands that. You're on one foot for a split second, then you're off it again. Standing on one leg forces the pump to stay engaged, and this is precisely where circulation and fall prevention intersect completely. When balance declines, people move less. When movement drops, blood flow slows, swelling climbs, feet ache more, confidence erodes, and that's the very spiral we discussed at the outset. To train it, stand beside a counter or wall with one hand resting lightly on it for safety. Shift your weight onto one leg and lift the other foot just an inch off the floor. There's no need to lift it high at all. Stand tall, eyes forward, and resist curling your toes to grip the ground. Hold for 20 to 30 seconds, breathing normally throughout, then switch legs. That's one set. Begin with 2 rounds per side. As it becomes easier, rest your hand more and more lightly on the counter until eventually you can hover it just above the surface without touching. That longer, steadier squeeze keeps blood circulating and retrains your nerves to react faster when you trip. But balance alone won't fully restore the flow. For that, you need the single strongest version of the calf pump there is, and that's number 1,
Number 1, the standing calf pump hold. This is the movement I promised you back at the very start. And once you understand what it's doing inside your leg, you'll see exactly why vascular rehab programs around the entire world lean on it almost like a prescription. It resembles the calf raise from number 3 with one small twist that changes everything. The hold. You rise onto the balls of your feet and then you stay right there. Your calves function like pressure pumps, and holding at the top keeps that pump fully engaged long enough to genuinely clear out blood that's been stalling near your ankles and push it upward toward your heart. Ankle pumps rouse the system. The single leg hold trains your control. This movement moves the most blood of all, and it keeps it flowing. And the evidence supporting it is concrete, not speculation. In a randomized trial published in the Journal of Vascular Surgery, people dealing with genuinely poor leg circulation who followed a simple calf raise exercise program managed to walk considerably farther before pain kicked in. Their pain-free walking distance improved by dozens of meters, and their total walking distance climbed by nearly 100, with no medication and no equipment involved anywhere. That's the calf pump doing exactly the job it was built for. Here's the safe way to perform it. Stand behind a chair or at a counter, hands resting there for balance, feet roughly hip-width apart. Rise slowly onto the balls of your feet, heels lifting as high as feels comfortable. Now hold for 3 to 5 seconds at the very top, breathing normally, eyes forward. Then lower yourself back down slowly, taking about 3 seconds to reach the bottom. That's 1 rep. Start with 8 to 10 reps. Build over time toward 15 or 20. Always controlled, never rushed. The hold is the entire point. That sustained squeeze keeps the pump fully engaged, pushes blood upward, reduces swelling, and strengthens the exact muscles your body relies on to catch itself. And since there's no jumping and no impact anywhere in it, it's gentle enough for most people managing arthritis or unsteady balance, provided you keep one hand on that counter. So, let me tell you what happened with Robert, because this is where it all came together for him. I had him stop fixating on his step count and instead perform these 5 movements in sequence for about 12 minutes daily. Ankle pumps in his chair first thing each morning, seated leg lifts, supported calf raises at the kitchen counter while his coffee brewed, the balance holds, and the standing calf pump holds to finish. Now I'll be honest with you about his results because I always am. His circulation didn't magically turn into a 30-year-old's overnight, and I'd never promise you that. But within a few weeks, his ankles stopped ballooning by dinner time, his feet stayed warmer at night, and the thing he told me mattered most. He stopped feeling like he might tip over when standing up from the couch. He felt steady again. For a man who'd been quietly terrified of falling, that changed everything. Before I let you go, I owe you one honest word of caution, because I'd much rather you be safe than sorry. If you ever experience sudden, severe pain in one leg, or a leg turns pale, cold, and numb out of nowhere, or you develop a sore on your foot or ankle that simply won't heal, please don't sit at home doing exercises. That's something you need looked at quickly because it can signal a seriously blocked artery, and that's an emergency. Everything I've shown you today addresses slow, chronic, everyday poor circulation, not a sudden crisis like that. So there you have it. 5 movements that wake up your second heart and push blood back up out of your legs. Let me give you a quick recap. Number 5, ankle pumps to wake the pump up. Number 4, seated leg lifts to move blood through the thighs. Number 3, supported calf raises for circulation and balance together. Number 2, the single leg hold for that long, steady squeeze and the balance that keeps you upright. And number 1, the standing calf pump hold, the most powerful of them all. The one I'd choose without hesitation if forced to pick just one. Keep walking, by the way. Walking is wonderful, and I never want you to stop. But walking alone leaves a real gap, and these 5 movements fill it. They take less than 15 minutes a day, cost you absolutely nothing, and you can do every one of them at home in front of the television. Your circulation is one of the very few things about aging where you actually get a real say. This is how you exercise it. If this helped you today, go ahead and subscribe so the next one finds its way to you. Give this video a like and tell me down in the comments which movement you're starting with first. Take good care of those legs of yours. They've carried you this far, and with just a few honest minutes a day, they'll carry you a good while longer. I'm Dr. James Myers. See you soon.